So the answer for the first question, what were some things you learned and what way you will improve your MI skills in the future? Well, in this case, I interviewed my dad, and I think it's easier to have a format for all questions. And when I did the interview, it has more flow when I had these questions and I don't forget anything. That way I can do a better assessment. And with the MI skills as a future dietitian, it will help me to know how motivated the patient is, and I can do as well. I can learn strategies to motivate the patient. For example, I can suggest exercise, or I can find fun recipes. Or I can just know how to help my patient. And the question number two, I can say that during the interview, I was reading the Screen 14 format, and I tried to integrate the questions and then do it like a casual conversation. For example, I asked my dad, what was your weight? And do you know if it's a healthy weight? And do you know what it means BMI? He didn't have an idea. He was like, no, I only know that sometimes I don't have a healthy habits because I eat a lot of fast food or fried stuff. And so during the the interview, I just try to integrate those questions as a casual conversation, as I mentioned before, and and that way it will help the patient and the dietitian to make it more casual, as I mentioned again. And number three, yes, I found two CCHD groups. One it calls the Victim Offender Reconciliation Program and Justice Overcoming Boundaries in San Diego. The both programs are in downtown. It's around 15 minutes far from my home driving. And about the food apartheid, I don't have any, or I couldn't find anything. Only the San Diego Food Bank, that they help people in low income to get food. And if and for number four, I will say that unfortunately health outcomes are influenced by social economic factors because insurance are super expensive, I can tell. And if you want more stuff to cover, you need to pay more in the insurance. And I think the more affected is the middle class because they don't have a they don't get paid that good to get a better insurance, and they cannot apply for a federal insurance, in this case medical. uh, and I think it will be beneficial if they adjust the wages, that way they can apply for a better healthcare.